A very good morning to all. In today's module, we are going to learn therapeutic diet and counseling. And this is K.Jansi Rani, Assistant Professor and Head, Department of Nutrition and Dietetics, SFA Women's College, Sivagasi. So in this paper, a learner will be able to summarize the concept of diet counseling, and he or she will be able to identify the etiology and symptoms of various diseases and suggest and modify diet accordingly. And also one will be able to plan diet for various disease conditions and deficiency diseases. And also one can interpret the principles of diet and diet counseling and the nutritional requirements for various diseases, and also create sample diet chart and diet plans for any individual with various diseases. So we are entering into the module. The name, it says that therapeutic diet and counseling. So therapeutic diet and counseling generally deals with a diet which is meant for a patient who is been suffering from a disease or identified with a disease. So diet is as important as medicine in the treatment of disease. As we all know, many of the diseases, especially nowadays, are being treated only with the help of diet and lifestyle modifications. So a best example for such disease is diabetic mellitus, cardiovascular disease, and so on. Any non-communicable diseases, lifestyle diseases may be treated only with the help of diet, not only with the help of medicines. So therapeutic diets are designed to assist a resident or hospitalized patient with nutritional issue or any other diseases to suggest diet modifications. So it is on everyday basis a patient, what all the patient can have in his everyday food, and what are the modifications and what are the suggestions he has to be followed, that will be given by a dietitian. So this modification in the diet can cure certain diseases and also prevent certain diseases in case if it is followed on finding the symptoms of the diseases. So diet counseling plays a very vital role in treating the patient's disease. So in that note, diet counseling is a process of treating chronic health issues, reducing excess weight, treating eating disorders through nutritious food, and so on. A diet counseling is nothing but a practicing dietitian giving the modification of diet to the patient. It is not that a patient, it is not like giving a chart or diet plans to the patient. It is an one-to-one conversation. It is a personal kind of counseling to touch the mind of the people and to make changes in their lives and their lifestyles. It promotes a balanced selection of food vitals for good health. A diet counseling is not only pattern to followed when you are in a recovery period or in a treatment period. It is one such thing which has to be a life-changing practice which promotes your health of you and your family members. The students will be able to analyze the symptoms and provide disproportionate diet plans, appropriate diet plans for the person. She can be able to expertise in the diet therapy and counseling too. So it will be useful for the student to utilize various food products based on the need of the patient by doing proper food management. It is also give insight to some dietitian, some students who are following this module. They also will be able to invent and design value added innovative food products that may help to combat deficiency disorders and diseases in the future. So diet counseling is a form of assessment that looks at various health needs and determines what type of diet and lifestyle changes can help to achieve the health goods. So it is just as I told you earlier, a diet counseling is not just giving diet chart or not just giving a diet plan to a patient. It is a one-to-one counseling that has to touch the minds of the people, and it has to convince the patient to take up this new modifications in their life and to take up a new choice of food and new style of lifestyle, everything not only during the period of recovery or treatment, but also as a lifetime changes which we have to brought into the patient's mind. It provides the individualized nutritional care for each and every patient, and as I told you, diet counseling or giving diet chart is not just that giving a prepared or pre-prepared charts to the patient. It should be an individualized diet plan which has to be given in such a way that each and every individual have to know what it is, what is inside the diet chart, and it has to suit the particular individual's beliefs and certain habituals he has been following since his childhood. So these are the objectives. A diet counseling or diet plan or a diet counseling session should be planned in such a way to maintain good nutritional status, to correct nutrition deficiencies if any with the patients, to support the recovery. It has to fasten the recovery, it has to support the speedy recovery of the patient if it is for particular disease, to bring about the changes in the body weight whenever there is necessary, and it has to adjust the food intake to the body's ability to metabolize the nutrients during the disease. So the diet plan's main objective, it has to be given in such a way to adjust the food habits of the patient throughout the recovery period. So nutritional assessment, so to give a nutritional counseling or diet to a patient, we have to do an assessment. So unless and until a dietitian knows the assessment of the patient, know the details of the patient, disease condition of the patient, symptoms of the patient, she or he cannot give a diet counseling or diet plan appropriate for the patient. So the first and foremost step in planning a diet counseling session is to assess the patient. So nutritional assessment is the steps that involves the assessment that is to be done by systematic process of collecting and interpreting the information from the patients or from the attenders of the patient. So soon after the admission, if it is a case of inpatient, soon after the patient getting admitted into the hospital, a dietitian who is in charge of the ward should go and check the patient's case sheet. If the information required by the dietitian is not available in the case sheet, it has to be gained from the patient or from the attender. So we have to check their height, weight, BMI, that is anthropometric, and biochemical things which is been taken from the paramedical blood samples, and the clinical assessment which is also can be available from the blood samples, and the dietary details which has to be get by the dietitians. So these are the data which we have to get from the dietitian, from the patients to plan and provide diet counseling to a patient to treat his disease, to speed up his recovery period. So this we call it as ABCD method. A stands for anthropometric, which involves height, weight, body fat indexes, which is physical body measurements, and all the body physical measurements, which includes height, weight, BMI, mid-arm circumference if it is in the case of children, and hip waist ratio if it is in the case of adult. And biochemical comes under all the biochemical values, like if it is a kidney patient, if it is a patient admitted for a kidney disease, you have to check his bun, and creatinine, everything has to be checked well. If it is not available, you have to wait till the test results comes. And clinical, which involves all the medical history of the patient, and dietary, which should get gained from the patient or the attender, that what are the basic allergies if the patient have already been with, or any particular beliefs, or maybe like patients if he or she is vegetarian or a non-vegetarian patient. So after getting all these things, this we call it global assessment. After getting all these details, one can move into planning a diet for a particular patient. So when planning a diet chart, you also have to make sure that the patient will be able to follow the diet plans we are giving. It also should cover all the necessary requirements, all the necessary modifications and suggestions which we have to make sure to to recover the to ensure the speedy recovery of the patient from the disease. First and foremost step in treating a patient from a disease is to eradicate the symptoms caused by the disease. So the first step, if it is a patient from cardiovascular section, so we have to check first, eradicate the symptom of the disease, which is if the fat level is high, or if the patient has been notified with severe hypertension, all those things have to be eradicated on the first sitting of the diet counseling. Within a period of minimum 4 to maximum a week's time, we have to get rid of the symptoms which is being given in the case of disease. So if it is a patient from cardiovascular disease, you have to first try to eradicate the symptoms such as hypertension or LDL level, elevated LDL level to be reduced down. And these are the basic things we have to plan in a diet chart. So after planning a diet, we have to go for a one-on-one diet counseling with the patient. To make sure a patient's diet counseling relationship, we have to ensure that we have to create a therapeutic rapport, which is an essential part of a healthy therapeutic diet relationship. So one thing we have to do in such a case is, you have to create a rapport with the patient by meeting him every day if it is an inpatient. So to meet him every day, check with the ailments he has after every meals, and also to make a note that you have to eradicate the symptoms, eradicate the ailments which has to be eliminated from his body as soon as possible. So it has to contribute to the client feeling good and safe to be in front of you. So it has to be with a good therapeutic rapport. Only then a client feels their therapist is safe and good enough to give us diet counseling to him. So the most important thing, apart from the rapport, the most important thing a diet therapist should maintain is confidentiality of the patient. So you don't know what kind of patient you are getting for today's counseling. So you may get a patient suffering from HIV positive. So unless and until it is very mandatory, you are not supposed to unveil the patient's details to anybody outside the hospital area. Unless it is very important, you should not tell the patient's history to anybody else. So it is a particular thing to maintain the confidentiality of the patient, and which is one of the very basic code of ethics for a dietitian or any hospital professional to be followed. So these are the things which we have to follow. When you create diet, relationship building is a main thing, rapport building is the main thing. After that, you have to use what are the resources you can use for the diet counseling. So there are many records and aids and resources you can use for diet counseling. First thing is food records. Food records, as we all know, it is nothing but a patient, maybe for example it is a patient with food allergy, you have to ask them to maintain a food record which has to be maybe for a 24-hour recall, which has to be maintained throughout the week. So by getting the food record from the patient or the attender, you can start giving him a detailed counseling session. So dietary recall, what are the food, what are the dietary patterns the patient has been following for years, and that is to be followed. And questionnaire, you can give him questionnaire questionnaire, one personal thing I have in questionnaire is, it is not that you can, if a patient is suffering from, generally for outpatient coming for health checkup or something, he will be in maybe in upset by his records and so on. It may create some kind of upset for patient if you are going to give him to fill a questionnaire in that moment. So if it is a case, you can avoid getting questionnaires from the patient. So you can get the necessary details from talking to him in person, and with the one-to-one conversation you can get the details you needed. And diet histories, again any kind of allergy, if the patient is allergic to any kind of particular food, for example you can say some patients will be allergic to milk and milk products, some will be allergic to peanuts, and such a kind of allergy should be known from the patients before giving a diet plan to him. And biochemical indices, you have to be thorough with the biochemical indices of the patient before you start giving him a counseling. So for that you have to check with either check with the case sheet, or you can get the computerized test report which will be given to you in prior if it is a case of an outpatient. So after that, after getting the details from the patient, you will be preparing a diet chart and to start a one-to-one session, and to make it effective, to make it very known to people to coming to you, you can use lots of audiovisual aids, and you can use pamphlets, and you can use the colorful do's and don'ts charts prepared earlier to be given it to them. For instance, if you have a patient with anything, pediatric patient, if you have any pediatric patient, unless and until you give them a very colorful charts, you will be knowing to give them a different kinds of food which they can include in their diet. So with the help of a colorful chart, you can ask them to provide various things, information you want to provide them. So with the final thing in this module is to end up a counseling session, you are a dietitian are supposed to give a diet prescription, which is a prescribed form of diet chart which has to be sent to the patient when the time of discharge, or at the time of at the end of the session if it is an outpatient or health checkup patient. So every patient should be given with a diet prescription in which what all the do's and don'ts should be included, what all the diets right from the early morning till the dinner time, what all the diets to be taken, what all the diet modifications to be given, particularly to be given to the patient in the written format. It is to be in such a way that anytime if the patient takes and refers, he has to be in such a way that the patient can recollect all the things with the diet prescription itself. And unless the doctor's prescription, a dietitian prescription should be in a readable form, that is anybody who is reading the diet prescription must understand the prescription, so that it will be easy for them to follow in any particular period of their life. So a formal prescription of calculated micro and macronutrients, as well as the type of diet that has to be included which suits the body and the disease condition of the patient, should be included in the prescribed diet chart. And it also should be given with the details of nutritional prescriptions, what are the things to be, and amount of fluid in case of renal patient, and the amount of fat and all the micro and macronutrients involved. And it also should include the diet do's and don'ts, and it also should include the exercise patterns and the lifestyle modification, salt intake, and what all the essential part of everyday's diet should be included in the diet prescription. So these are the things which so in today's module which we saw about right from the patient getting entered into the hospital, what are the things you have to do, and assessment, what are the assessment you have to do, and what are the diet charts, and what is the relationship you have to meet, and finally what is the diet prescription you have given to the patient when during the time of discharge or at the time of leaving, if it is a case of an outpatient for a health checkup or diet checkup. So this will be helpful for you to make changes in the people. And apart from these, a dietitian should know, and dietitian should be very patient. He or she should know there may be a stubborn patient, there may be a stubborn mind which you have to touch them, which you have to make them understand what you are telling, make them realize what you are telling, make them trust what you are telling by the means of a very patient and very ethical, legit way of giving them counseling. So there may be some rigid people, there may be some stubborn patient in such a case of, maybe for instance you can say bariatric surgery people, they will be very stubborn in eating what they want. So in such a case you have to make sure you are in a condition to make them understand what you are trying to say, and be calm but strong in what you are telling, be polite, and you are here to touch the minds of people and change the lives of people by your support. So the people coming to us will be in a diseased condition, maybe in the diseased condition, so they may be already a piece of mind will be disturbed. So you have to make sure that you are when you sit in front of a patient, you have to make sure that you are in peace of mind to give peace of mind to people, not into a pieces of mind which makes the client or a patient untrust you. So this I hope this will be helpful for you if you are in a position to understand what a diet counseling is. So thank you. I will meet you with another interesting topic in another video. Thank you.